The way we manage Health and Medical Technical Authority, unlike engineering and safety, which really is relevant to any program and project NASA does, Health and Medical Technical Authority, the main focus really is related to human spaceflight, particularly human rating of vehicles. So unlike engineering and safety, that has engineers and safety experts at all the centers, health and medical is much more limited. The main focus for Health and Medical Technical Authority is at Johnson Space Center. And in fact, all Health and Medical Technical Authority for human spaceflight has been delegated by the Chief Health and Medical Officer down to JSC into what is now the Human Health and Performance Directorate, because that's where all the health and medical expertise in the agency pretty much resides there. It has caused a little bit of a problem because, unfortunately, not all the human-related, human space-like programs and projects are being managed at Johnson. The Space Launch System, SLS, is being developed down at Marshall Space Center. The ground operations system for human exploration is at Kennedy Space Center. So for Health and Medical Technical Authority, we've had a little bit of an issue in terms of not having boots on the ground at all the NASA centers for people who could look after Health and Medical Technical Authority. So what we've done as we established Health and Medical Technical Authority in the mid 2000s, 2005, 2006, is we have an agreement with engineering and safety. Since they have experts at all the centers, we have an agreement with them where if they're working on a program or project and they see there's an issue bubbling up that's kind of a health or medical issue, they'll notify the folks at Johnson Space Center and say, hey, there's something going on here. You folks need to get more plugged into that. So we have this agreement where engineering and safety kind of acts as our eyes and ears at the centers where perhaps there isn't the health or medical expertise on the ground. Doesn't mean we're delegating Health and Medical Technical Authority to them. They're just kind of our awareness line, if you will. And then if they see something, they'll notify us, and then we'll get our health and medical experts involved. It's been working well. The problem, obviously, is that there's only so many people at Johnson Space Center working Health and Medical Technical Authority. The agency, obviously, is very active in space exploration, developing Orion, developing SLS, ground operations, the Commercial Crew Program. So there's some research constraints. They're spread very thin at Johnson Space Center to do Health and Medical Technical Authority, but we have a good team down there who work really hard. It's amazing the amount of work the folks down there get done. But so in terms of Health and Medical Technical Authority, as the agency progresses and all the space exploration systems and development mature, and one can envision down the road they'll be developing habitats beyond just the Orion spacecraft. So there's going to be even more human exploration. Again, Health and Medical Technical Authority will be involved because all these, whatever it will be human rated. There might be a need for an increase in personnel and resources for Health and Medical Technical Authority just to cover everything that's going to have to be watched over.